Greetings and welcome to the For Health Scholars channel. My name is Dr. Arubasa, and on this channel, I show current and aspiring healthcare management, administration, and public health students how to one, quickly and successfully earn their degrees, and two, how to start, build, and enjoy profitable careers within the business side of the healthcare industry globally. Now, just a little bit about myself. I am a professor of healthcare management, administration, and public health. I'm also an author, speaker, and global mentor. I have over 15 years of experience working on the leadership and management side of the healthcare industry. And lastly, I obtained all of my degrees, so my bachelor's, master's, and doctorate in health administration. So it's safe to say that I am an expert in this field, but more importantly, I'm super excited to serve as your trusted virtual mentor. Now, today's video is all about how to become a doctor of health administration. And specifically, I'm going to talk about the steps on how to get started. But before I jump into the conversation for today, there are two things that I need you to do for me. So the first tip is, or the first thing rather, is for you to subscribe to this channel. And the second is for you to turn on your post notifications. Each and every week, I'll be going live to talk about different tips, tools, and resources that answers many of your questions that you may have about the business side of the healthcare industry as a student. Also, I'm going to be answering questions that you probably can't find on a basic Google search. So definitely subscribe and definitely turn on your post notifications. You don't want to miss out. So as I stated, today's video is all about how to become a doctor of health administration. And particularly, we're going to talk about the process of how to get started. And so if you don't know, a doctor of health administration is an individual who has advanced training and learning how to use to strategically identify the dilemmas, problems, and gaps within the healthcare industry. Additionally, as a doctor of health administration, they are able to use scientific literature and evidence-based practices to mitigate the gaps that they or dilemmas or problems that they identified. And they're also able to use the same processes to shape the direction of the healthcare system of healthcare systems globally. Now, for many of you, you may have heard of a PhD scholar or a PhD holder, right? And for some, you may have heard of a PhD in health administration, but not much limelight gets shared on the professional doctorates, and particularly in this case, in the field of health administration, the DHA degree. But today, I am going to provide you with great insight on what the degrees are all about, particularly if you are an individual who is interested in getting a doctorate in the business side of healthcare, but you're not sure which route may be best for you. So I believe a PhD holder in health administration is an individual who creates new research, right? So they've identified a problem or dilemma or a gap to investigate, and they use what we call theoretical frameworks to guide and really navigate their research process. They create a study around it, they draft a manuscript, and then they publish that manuscript through their university. But for the professional doctorate, it's still a research degree, but the process is slightly different. So as a DHA scholar, you are identifying also an existing problem, dilemma, or gap within a given healthcare system, whether it be an organization, program, or service that you know of. Particularly as a DHA scholar, you are using your experience from the field to shape your research. And instead of using a theoretical framework to navigate your research, oftentimes a DHA scholar is using what we call a conceptual or applied framework to conduct their research study, which is often a project. As a DHA scholar, you're also required to do a practicum. And so a practicum is slightly different than an internship. As an intern, you're going to an organization and you're working in different tasks to help you further gain, I would say, work experience in the field. But as a DHA scholar, your practicum is the site and where you're going to conduct your DHA program project, excuse me, which is also known as your capstone. All right. Now, a PhD scholar, your schooling is a little longer, so it may take you about 6 to 8 years to complete your program, whereas a DHA scholar, it can take them anywhere from 3 to 5 years to complete their program, depending on whether they're going full-time or part-time and some other different criteria that they have to pass before their degree is conferred. Now, with both degrees, I will tell you that you are able to work within an academic institution. All right. So if you are a PhD recipient or a DHA recipient, you can work as a professor. I work as a professor. Okay. And I've been working as a professor for the last 6 years. Also, with both degrees, you can work as a consultant or you can even work within the healthcare system. Now, for many PhD recipients, they are often wanting to go into academia and they're also trying to conduct more research. All right. So, going back into the field as a consultant or just a healthcare employee is not something that they traditionally do, but it's very much possible. Both degrees also allows you to work as high-level executives. So if you want to work in a role as CEO, COO, CFO, and any other high-level leadership position within a healthcare organization, that is very much viable and possible for you as a DHA holder, a degree holder, or a PhD recipient. But specifically, I want to talk about the Doctor of Health Administration. Now, these individuals, once they graduate, they tend to choose to embark on the executive leadership route or embark on consultancy or even work as an adjunct faculty member. Now, this is not an exhaustive list of all of the different roles that either a PhD in health administration recipient can do or a DHA recipient can do, but these are just the traditional ones that they go to. So please don't be like, she only said these few ones. Okay. There are many roles that you can work in, especially in healthcare, because we know the system is multifaceted and highly dynamic. Now, I do want to talk about the steps of becoming a doctor of health administration because, like I said, I don't feel like the degree gets enough limelight about, the importance of this degree, as well as they're not just in general much information about what it really entails in becoming any type of doctor in the business side of healthcare. So I want to talk about the professional doctorate today. In another video, I can talk about the research doctorate, which is the PhD. So step number one is to start with your end goal in mind. And really, this is an opportunity for you to ask yourself, what is your why? Why do you want to acquire a degree in a doctorate degree at that in health administration? Because this is very important as you navigate the doctoral journey. Unlike your bachelor's or master's degree programs, the doctoral journey is quite different. Okay. There is, of course, academic rigor there, but as an individual who's probably a healthcare professional working in the field, you're probably a healthcare leader. The doctoral journey really is not there to teach you how to be a healthcare leader, but is more so teaching you how to conduct research and to identify problems using research so that you can effectively create solutions and lead. All right. So you do want to start with your end goal in mind, because when the times get challenging, all right, especially when you passed all of your didactic courses, okay, and you have to get into the writing stages of your capstone or your dissertation, it is a different experience that I don't think anybody is really prepared for. Okay. Like I said, I went through the process really blind. And throughout the process, there were times where I was really frustrated and I wanted to give up. And so what prevented me from giving up was always the reminder of, why did I want to get this degree? What is my end goal? Then step number two is to conduct research in the various DHA schools, programs, and faculty members. This is very important, okay? With any doctorate degree, you are becoming a researcher, just hands down. I just want to tell you that just in case you didn't know. You are becoming a researcher, but particularly it is good if you know how to conduct research very early. And when you're trying to determine which program is best for you to acquire your DHA and even your PhD, you should really learn more about the program. Some of the things that you should be looking out for is accreditation. Okay, that's key. One thing you do not want to do is to go through this rigorous process only to find out that your program is not accredited, and that can cause for your degree not to be valid or even credible. So you do want to make sure that your program is accredited. Most universities, they have accreditation in other degrees, but specifically check for the accreditation for your degree program, which in this case is the DHA. Also, research what is the university's success rate with graduating doctoral students. That is very important. Okay, if they have a low graduation rate, that can allow you to make a very important decision. Okay, I'll say it like that. All right. And also research the faculty members within the program. Now, as a doctoral student, whether you're a PhD on the PhD track or on the DHA track, you're going to be appointed a mentor. Now, sometimes you have to go pick the mentor, and so you have to reach out to them and they have to just agree whether they are interested in supervising your research. And other times the university may assign a mentor to you, but you do want to research your mentor. You want to look at their accomplishments. You want to look at their publications. You want to learn if from other students that they have mentored what their process was like, because the mentor is very vital. Your mentor is very vital to your doctoral journey. They are going to be there to support you through the journey, especially when times are starting to get challenging and you're starting to question your whole, once again, reason why you wanted to do this program. You want to make sure that you have a mentor who's truly supportive, who also can give you critical feedback on how to improve your manuscript, because I'm here to tell you your first draft is never the draft. Okay, it's going to go, your manuscript is going to go through a series of revisions. So you want to make sure that your mentor is able to articulate and even explain to you the revisions that are needed from that or have been requested from the external reviewers. Okay, so your mentor is not the one who decides whether you get conferred with your degree or not. It's usually the president of the university and a committee, but your mentor should be an advocate for you. And my own experience, I will tell you, I had two mentors throughout my journey. One mentor, the change was because the mentor left the university. The other change is because I requested it. I felt like the first mentor I received, she wasn't an individual who understood my direction and my vision that I wanted to exude with my own doctoral manuscript. And we didn't necessarily see eye to eye. And so I learned very early on that if, you and your mentor are having distinct discrepancies, things that really cannot be resolved, that you can opt to have a change. And that's what I did. But it's not just because they told you something that was incorrect or you don't agree with their feedback is a need for you to change. No, that's not what I'm saying. But I am telling you, if that person is not a champion for you, if that person is having different views that you cannot align with, because for the most part, as a doctoral student in health administration, you are a leader in your field. All right, so you're acquiring this terminal degree because you're looking to, once again, solve problems in an advanced way, or to even have an increase in compensation. All right, we're not oblivious to that either, right? You want to make sure that that mentor is supporting you. So research on them. And now when you've gathered all of the research and you've determined, okay, this is the universities that I want to apply for, be proactive and prepare your admissions application. This is very important, okay? Your admissions application may vary from university to university. They all have a standard form that you probably have to complete, but some of the other materials that they need you to attach may slightly vary. Some universities may ask you to include a personal statement. Other universities will tell you include a personal statement and another type of essay. Also to include your CV, get recommendations letters. Some may tell you to include your GMAT or GRE scores. So it's very important for you as the anticipating DHA scholar to make sure that you are providing all the material that the application is asking for, that you're proofreading the material before you submit it. Because one red flag, and I'm now wearing my professor hat, is that when we see a candidate submit an application and it's full of errors or typos or it's missing documentation, it is one of the quickest ways for us to eliminate the application. All right, imagine we're getting a lot of applications that we have to review at a short period of time. All right. So you have to make sure that you include all of the material that is requested so that you can be considered, okay? Because it doesn't take much for the committee to say, no, this is not a person if they cannot really perform in the beginning of getting us the basic essential material. How will they perform within the program? And another tip I would tell you, especially if you are responsible for writing what we call a personal statement, please include the you aspect in your personal statement. All right. That document is there for you to prove through your writing to the reviewers and the people who are doing enrollment why you are a great fit for the program. Okay. And from some of the applications that I have read, sometimes the applicant gets so caught up in the technical aspect and just trying to show to us what they know about the problems and the things that's happening in the industry that they forget to include the you aspect in their personal statement. So tell us why you want to be a doctor of health administration. Talk about your goals. Talk about what you will do with the degree once you obtain it. This information is very, very vital, and it helps you stand out versus other candidates who do not do it. But still, keep in mind to always be writing in error-free and using the appropriate writing format, which in the health sciences is usually APA. Okay, so keep that in mind. Step number 4, submit your application and start preparing yourself for your DHA acceptance and the journey ahead, because we're speaking the acceptance into existence, okay? One thing that you will notice about the doctoral journey, it is really unique, as I stated. It is going to test every aspect of your being. You really need to have a strong support system in place. You need to be able to set barriers and goals and things that you need to do. I would say set barriers, also set goals, and also talk to individuals who are going to be in your support, and explain to them what this process will really mean for you. Sometimes you're not going to make it to family occasions. Sometimes you cannot turn up. Sometimes you are not going to be in a good mood. And so helping them understand the journey that you're about to embark on will also prepare you to successfully navigate and get the degree at the finish line. And then step number 5 is, once you've been accepted to the program, network, network, network. This is vital. And this is something that I wish I did. It is important to network with the students in your cohort, students who are maybe a year or two ahead of you in their research, students who have completed the program. Having these conversations with different types of people is vital. Even speak with other faculty members, okay, about what is entailed in this journey. That is important. And like I said, it's something that I wish I did. I think in my process, I was so just caught up in trying to manage my day job, teaching as an adjunct faculty member, and then getting the schoolwork in on time, writing extensively and writing so that the manuscript can get done. So it's very easy for you to get caught up in the process. And I will tell you, just having these different types of conversations can really answer a lot of questions that you may have and prepare you for when you do experience a situation that you were not expecting, and how to either circumnavigate that situation and even resolve the situation, which we hope towards the end. Okay, and then the last tip, which is a bonus tip, always be learning. Read the evidence-based literature. Remember, a DHA degree is a professional doctorate that is evidence-based. And if you engage in the habit or start a habit of reading literature from your industry, and then that's a specialty rather, and then just from the general industry, that is a good practice as a doctoral scholar. And when I say for specialty, you may be taking a Doctor of Health Administration degree, but underneath that, it has a subspecialty. So in my case, I was very much interested in human capital development at the executive leadership side. So my research was geared towards that. But another student in the same program may be interested in health policy and program evaluation. Another individual may be interested in quality improvement and risk management. All right. So there are different specialties with underneath the health administration umbrella. So to determine which route you would like to go in, to learn about what's happening in this ever evolving field, because we know the healthcare industry, once again, is multifaceted, it is highly complex and dynamic. Always be reading published literature, particularly literature that has been peer reviewed. And that is another way to prepare yourself in the writing stages. It allows you to write at the level, as a doctoral level, rather, by seeing other individuals who've gone through similar processes as you. When you're publishing research at the professional level, you're also going through a review process. You're going to have to submit to a committee. The publication house may request for changes. And so at the doctoral level, through your university experience, really prepares you for that. So always be reading the literature. So to recap my 6 tips on how to get started in becoming a doctor of health administration. Step number 1, you want to start with your end goal in mind. Always keep yourself reminded of your why. Step number 2, conduct research in various DHA schools, programs, and faculty, and then make a very informed decision based on the research that you found. After you've done that research, step number 3 is to be proactive and prepare your admissions application. Include all of the important material that they're requesting. And then step number 4 is to submit your application and start preparing yourself for the journey ahead of you. And then step number 5 is to network. And the last bonus step is to always be learning, always be reading the literature. So once again, I want to thank you for tuning in to today's episode. I hope that it was extremely helpful to you if you are an individual who may be thinking about starting a doctoral degree specifically in health administration, or if you're already in the journey, in the beginning stages rather, and you just need some more insight. Thank you for tuning in. Once again, make sure to stay subscribed to the channel. You can also connect with me on LinkedIn if you would like to connect with someone who has gone through the process and you would like to just ask questions or even get some external support outside of the university. I'm more than happy to have a conversation with you. So you can connect with me on LinkedIn. You can also sign up on our newsletter, which the link is located within the description box. All right. So stay connected. And I promise next week I'll be back with another video from the series on how to become a doctor of health administration. So until then, bye for now.